on there.
Good morning,
Kelly,
everybody.
he's not going to be able to come. So Jim's on.
Yeah.
Welcome to 70 degrees on December 15th. Nice morning. Let's hope the rest of the day stays that way. All right, we've got a couple of educationals to start off this board meeting this morning, so we will turn it over to Jill. I believe you're up first for Human Resources, please.
You want to run it, Jeff?
It's up to you.
Well, good morning.
Good morning.
So I'm Jill Magus. I'm Chief HR Officer at Myrtue, and Human Resources is an area that I oversee, and the purpose of this department really is to provide an experience that has all of our recruits who are trying to hire, our employees, and the community strongly recommending Myrtue. And so these individuals are really at the center of what this department does throughout the entire life cycle of someone's career, from recruitment, the work we do in onboarding in their first 90 days to keep them engaged, engagement throughout their career, to retain them and keep them loyal employees so that they're continuously recommending Myrtue as a great place to work. This is a pretty important measure for human resources, and one that we pay close attention to. This is our annual engagement survey question of overall, I'm satisfied with Myrtue as an employee. And we've received 92% positive responses to this question. And this is very important for HR because if your employees are satisfied, they're more likely to recommend Myrtue as a great place to work and a great place to receive services. And satisfied employees are also more likely to stay. So in looking at HR's role in the employee experience, we have 3 staff members, two full-time, myself and Sherry Kaufman, and 1 part-time. Sherry's been here for 10 years, Carla's been here for 9 years, and myself for 3. And this is how HR really influences that experience throughout the employment process. We handle all of the recruitment and the pre-boarding, relationship management post-hire, so throughout an individual's career. Position management includes those position changes or promotions that we administer. Benefits administration, we develop the plan design, we implement the plan design. We go through an annual open enrollment process with our employees that we've streamlined. I brought to the board a couple years ago. We implemented a brand new human capital management system to allow us to do that more efficiently. Leave management, so this is really income protection for our employees should they need to be off work due to sickness or other time off. Performance, we handle and manage all of the job descriptions, performance coaching and evaluations. Annually, we perform the wage and market analysis. And from a compliance perspective, we're maintaining personnel records, updating policies, and communicating regulatory changes, which the last couple of years really, we had several of them related to the hospital and how that impacted our staff. Looking at our workforce, Myrtue is comprised of about 414 total employees. This does include our Shelby County Medical Corps employed physicians. A majority of our staff are full-time, as you can see. We do have a high retention rate at 83%. You know, we benchmark ourselves against other Iowa hospitals, and we report that annually through the Iowa Hospital Association turnover salary report. We are right in line with other Iowa hospitals. They reported between 15 and 18.5% this last year for turnover rates, and that's really about where we're sitting. We do not include our wellness center staff in this number because it's not comparable to other Iowa hospitals. They don't have other wellness centers, so that's how we arrive at our 83% retention. About 37% of our total population is comprised of our nursing staff, and so we do have 16% nursing turnover currently. So what do those reasons look like? Why are people choosing to leave? The top reason here at Myrtue, voluntary, no reason given really, but personal reasons and other employment also top that. Retirement also tops this list, and you know, we look at other industry data, one of them being the National Healthcare Retention and Staffing Report. And this is the first year in like 3 years that retirement topped their top 3 list. And I think that's just, it's a strong indicator of what we're seeing in the labor market and nurses choosing to retire early. And that's exactly what they're reporting. So we're seeing some of that as well. Our vacancies, top vacancies at the hospital right now are in med-surg inpatient. So we have 3 full-time RNs and 2 full-time CNAs in that unit. We also have some on-call staff that we need to fill. But environmental services, dietary, coding, those also kind of top our list right now. And you know, those service industry positions like the housekeeping services and food service. I mean, those are positions even locally within our community where we're seeing a challenge in filling some of those jobs. I did want to show you this slide. I felt it was important. We do lean on Becker's Hospital Review, and they're reporting statistics from the Bureau of Labor Statistics. But you know, looking back prior to the pandemic and how many people were quitting their jobs then versus now, in the health services industry, we are seeing a 35% higher quit rate in the health services industry now than pre-pandemic. So that's pretty significant, but it is in comparison to all jobs, and all jobs are right up there with them. What I think is important here too, so Governor Kim Reynolds just this week issued a proclamation where she removed the retirement limitation under IPERS. So under IPERS, you currently have to receive 4 benefit payments before you can return to an IPERS facility. Kim Reynolds' proclamation waived that requirement, so you can return with 1 benefit payment, and there are no longer any penalties for earning over the annual maximum under IPERS. That's temporary currently under her proclamation. She's done this before, and right now it's effective through the end of January. So I talk a lot about, HR's role in kind of influencing the employee experience. So I wanted to provide some information about what we've done system-wide, and not just HR. I mean, a lot of people are involved in these things, obviously, but what have we done to influence our employees' experience? Work from home opportunities. This is something we recently implemented, and COVID, I would say, kind of influenced us to do some of these things quicker than others. So some of our staff do have the opportunity to work from home. We've expanded our employee assistance network of providers, so our staff now have the opportunity to see more providers, not only at Myrtue's Behavioral Health, but in Council Bluffs, Omaha area. Hot breakfast service. So this is something that showed up on our strategic planning initiative this year, where employees just wanted really the basics of more hot breakfast when they come into work. So we felt we were going to be able to do this, and we did, and we now offer it 3 days a week. We offer an employee prescription discount pharmacy program, significant savings for our employees who utilize this benefit. We do not have a retail pharmacy, but our employees are able to use our pharmacy internally to fill scripts if they're enrolled in our coverage. We also,
Back up when he connects.
Employees appreciate time off, so we now provide additional hours of paid time off on an anniversary milestone for staff. We implemented the mobile timekeeping system, which we're getting good feedback on that because it's everything in one place. You're able to see your pay, your total rewards for working at Myrtue, take your time off. We enhanced our new employee orientation this last year. So all of our staff are hired on 2 days during the month. It creates a lot of consistency in that process. And we've offered a free family wellness center membership to our staff for as long as we've really been open, but I think that's an important benefit to point out. As far as public relations, I wanted to give you guys a sneak peek of what you're looking at is the cover of our upcoming Shelby County Health Foundation newsletter, which will publish and deliver in homes. We're hoping by the end of this month. So Myrtue and our marketing team are very involved in the development of that newsletter. The cover is very significant. We went through the Make a Splash fundraising campaign this last year. I'm happy to report that the pool is open as of this morning at 6 a.m. And so far during the campaign, we've raised just right at $235,000 toward the pool liner replacement and to replace equipment that's a decade old. This organization has contributed more than 7,300 volunteer hours in the last year. Barry reports that on our annual goals. This year also was the 10-year anniversary of the Erling Clinic, and Myrtue is one of 5 critical access hospitals in the nation to receive the Gold Plus Award for the STEMI referral care. So these are all things that we've promoted in the community and in the media this last year. And lastly, I just want to recognize these folks too, because I really do look at them as the experience makers, and they report under me and have a lot of influence on those items that I touched on earlier, the things that Myrtue is doing. Julie Klein, she's our director of dietary, and she also handles customer service and employee engagement activities. Laura Friend is our education coordinator, so she was heavily involved in that new employee orientation rollout. Todd, having put together a 10-year celebration over at the Wellness Center, and then this major renovation project, and then Gianni Sorfenden just does a ton of work marketing Myrtue. Any questions? Okay.
Thank you, Jill. And Michelle, next on the OB and Birthing Center.
Okay.
Good morning.
Good morning. Okay, my name is Michelle Munson, and I'm the Birthing Center Director, and just wanted to share a little bit about our Birthing Center and some of our staff that make that up. This is the group of nurses that we have that provide our care in our Birthing Center. We have some labor and delivery nurses, as well as our postpartum and baby nursery nurses. With the addition of Dr. Kelly Anderson, she's been here since last September, so she's been here just a little over a year in that time, and we're very fortunate to have her join our medical department at Myrtue. Everybody loves her, her patients love her, the other providers love her, the nurses do. She's just very nice to work with and a very skilled physician, so we're very fortunate to have her. Dr. Sarah Devine has been doing a lot more of our newborns. It seems like women of today are requesting or seeking out a female provider for their OBGYN. It doesn't seem like that was really an option, 30 years ago, but and they also seem to be seeking out specialists. So it seems like a lot of the women that choose Dr. Kelly Anderson for their OBGYN are also choosing Dr. Sarah Devine for their pediatrician. So they make a great team, and they provide a lot of care now in the birthing center. We also have our 4 family practitioners that deliver babies, Dr. Brian Anderson, Dr. Timothy Brelge, Dr. Brett Hylison, and Dr. Scott Markham. And they as well provide the maternity and the newborn care that's needed. So we do have a certified lactation consultant. I think a lot of times you only see those in larger hospitals. It's hard to get the training around here for them to have their internationally board certified lactation consultant accreditation. And so this, probably just in the last month, she started to be in the birthing center for 12 hours a week. So just like every other day, she's there for a few hours and pops in with the new moms. So hopefully trying to get them off to a good start instead of relearning. Sometimes it's easier to learn the right way than to have to relearn how to do something. And so meeting with those moms and babies early instead of, 3 days after they go home and things like that. So we're really hoping to do a lot with our breastfeeding education and consultations, working with the clinic in the prenatal consultation that Kara can meet with new moms who don't know what they want to do, and then hopefully we can, point out the benefits of breastfeeding and stuff to women that might not really know what they want to do and at least, be willing to try it. I do want to just talk about some of the exciting stats that we have for the year. So I'm just comparing July, August, and September of 2020 to July, August, and September of 2021. And you can see a year ago in that quarter we had 18 non-stress tests, OB consultation, observation hours. So that's when a woman comes in to be monitored and does not deliver, like they just don't know if they're in labor for sure and things like that. So, and then we had 12 deliveries in that quarter. But this year we had 79 non-stress tests and 268 observation hours and 20 deliveries. So you can see the growth in our department is significant. Dr. Kelly Anderson does keep a little bit higher risk patients. So say the diabetic mom while she's pregnant, there's national guidelines to do non-stress test weekly towards the end of her pregnancy to make sure that mom and baby are doing good. And so those require a little bit more outpatient procedures and stuff. So we're loving it. It's fun to have a busy department. And we also love our birthing center. We think it's a beautiful, calming, comforting place, but yet has all the medical necessities we need. Kind of hidden behind there, like that bed that looks like, just pretty, but those panels fold in and there's oxygen and suction and medical air, all different stuff that we need. So it's very functional and very pretty. So we really do like our labor area. One thing, it's been a year and a half that we've had this piece of equipment. It's called the Centricity, and what that allows us to do is to see the baby's heart rate and the mother's uterine activity, so contractions, at the nurse's desk. And this also allows the physicians to be able to see this in their office. So that's really nice when they're in the clinic that day and or on their phones. So it's amazing what technology can do, that they can be at their kids' soccer game and they can be watching their OB patients. So this is a really nice piece of equipment that was a big advancement for our department and appreciated by the physicians and the nurses. It's nice just to have a second eye on labor patterns. There's lots of different things that we're looking for. Fetal heart rate decelerations, accelerations, just lots of things. And so they can, look at that and also ask another nurse to look at it, or a physician that they're working with. So it's very nice. We just became this is it May? Yep. This past May, University of Iowa Mother's Milk Bank, and this is through the University of Iowa, and they handle all the screening process. So they do a health screening on women, and then we do the lab draw here, but then we send it into the University of Iowa lab. And if a mom produces a lot of extra breast milk, they can donate that breast milk, and then it's sent into the University of Iowa and they pasteurize it, and then send that out to hospitals for babies that need that, whether it's NICUs or it's just a regular nursery that the mom is having a delay, her milk's having a delay coming in. So that's a nice new service we've added. And one thing that Kara is working on now is also being a dispensary. So if we would have a baby that would need breast milk when they're here and their mom's just not producing yet and stuff, something that we could provide the newborn. So if that's something that their mom would want. So there's a lot of great things going on in OB. It seems like it's a time that you hear a lot of OB departments are closing, and Barry's trying to do some outreach with these other hospitals and seeing, if that's something that Dr. Kelly Anderson and I could go to them and establish an alternative for their patients, since they're no longer providing that OB services, that maybe they would want to refer, some of their patients to us. So that's something that we've got on the horizon to try to help our numbers grow, and it's just an exciting time. We're growing, and I think it's just the perfect storm to try to get more OBs and stuff that unfortunately some community hospitals are having the alternative and stuff to that, and those patients in their area still need maternity services. So we're hoping that we can provide that to those individuals. Does anybody have any questions about the birthing center or anything you'd like to ask?
I think it all sounds great, and I appreciate the marketing efforts. I know in the
Janice
past I've
busy.
watched your video,
Yeah.
really good video of the
Yeah.
whole unit,
Yeah.
the services and the facility looks great. So.
Thank you. We have an active website. That's kind of our clientele, are the young families that are in that social media. And Janny does a lot of things, Sydney from marketing. They are doing when you have a Google search and you type anything in, like baby, and you're a 20 to 40-year-old female, well then that's going to come up, a picture of Dr. Kelly Anderson or something about our birthing center. It's crazy what they can do now in social media. So they're trying all sorts of avenues. We've done some postcards, and just trying to get the word out there.
It's a good word. Thank you, Michelle.
Thanks, Terry.
Have a good day. Thanks. All right, Ruth, are you ready? Let's call this meeting to order at 7:54. So we'll go ahead and begin with the approval of both the October 26th minutes and the November 9th minutes. If everyone has had a chance, I'd take a motion for approval of both of those.
So moved.
Jim's moved. Is there a second? Leona seconds. All those in favor, please say aye. Aye. Opposed, same sign. All right, thank you. All right, medical staff meeting summary. I don't see Dr. Markham, so this must be Karen's.
Yep.
Good morning, Karen.
Good morning. Due to our meeting change, he already had a meeting set up with the ambulance EMS squad. So Dr. Markham wasn't able to join us, but I was going to go over the November 9th medical staff meeting summary. So of course, one of our hot topics is always coronavirus. So at that time we were talking about our rapid PCR tests. We have kind of a threshold at about 500 tests that we like to try and order more. So at that time we had ordered additional tests. We were up to 700. We did just meet with medical staff yesterday. We'd gotten down below 500 again. So currently we're around 600 and we're trying to order some more. So we're hoping the supply keeps coming in because the doctors we're seeing obviously an uptick in coronavirus, and we'd like to have those tests available. We still have the antigen tests that are over in the clinic. So those are also rapid tests. The antigen tests though, you have to wait till they're 24 hours symptomatic. So the PCR tests we do here at the hospital, they can be prior to that 24 hours. It's the antigen tests from the clinic are 24 hours beyond, and they have to be symptomatic for those. So just kind of went over that again with the medical staff and letting them know where we were at with our testing. Additionally, reminder to, at that time, for our employees who wanted to receive the COVID booster for vaccination, that was available through public health. Flu shot season, we did have, go over with the medical staff, all of our flu shots for our employees. We did have a significant uptick in religious exemptions this past time with 46 religious exemptions turned in. So went over that with the medical staff. Carrie Sonderman, who will be here a little later with you guys, but she also talked with the medical staff about some diagnostic imaging updates. So our MRI machine has been updated. We now have that larger bore, so that'll help a lot of our patients who are somewhat claustrophobic. You know, you don't have to go into that smaller bore now. It's a little wider bore, so pretty excited to have that update. They also have some new things like music and some other comfort measures, the bed that they lay on, etc. So pretty excited to have those updates. CT calcium scoring, I know that has been brought to you guys before, so that is out there. It has begun. There is that out-of-pocket expense of $75. And then the only other thing is patients have to hold their breath for about 20 to 30 seconds, which doesn't sound like long until you're holding your breath. But they do a practice with patients before they go into it to make sure they can do that. And as far as I know, that's been going really well. So we've had a few patients take advantage of that. And then our last one was our venous Doppler orders. Sometimes we can get those done in the same day. So Carrie talked with the medical staff and said if there's something that they want to see same day, just to call diagnostic imaging and see if we can get that arranged for them. So a nice service to have, especially if we can provide that same day. John Petchy joined the medical staff and discussed our new cardiac Holter monitor. So we have two different types of monitors. There's the real-time monitors, which are the event monitors, and then there's what we call the Holter monitors, which basically it's not real time, it's monitoring the patient real time, but we don't see it real time. So basically it stores it, and then cardiologists will go back and look at it to see if there's any events during that time, any cardiac events, the heart skipping beats, something like that. So we do have a new monitoring system that is water resistant, so it's pretty nice, and there's no wires to it. So in the past, there were all these wires, patients had to wear them, it kind of got cumbersome. Now they're wireless, they're patches, they can go get a shower with them on. So pretty excited to have that for patients' comfort. We can do 24, 48, or 7-day monitoring with those new monitors. So letting the medical staff know we have that, what was available, and we have 10 of those available now for our patients. And let's see, Dr. Markham, this was at the time when Dr. Markham did announce that Dr. Clickard had passed away. A very sad event for the medical staff, loss of a great physician, and just wanted to, have that moment with the medical staff to let them know. Any questions you guys have?
Questions for Karen? New technology sounds great. And no wires is always appreciated.
Yes, exactly.
So.
Thank you.
Thank you, Karen. And now the quality improvement report will turn to Ann. Good morning, Ann.
Good morning.
Hi.
So anesthesia looked at documentation on their informed consent. Just like with when a patient's going to surgery, the surgeon has to do an informed consent with the patient. Anesthesia has to do that as well. Diagnostic imaging looked at MRI, CT, and nuclear medication scans. Dietary monitored nutritional assessments, and then they make sure that the food temperature is where it needs to be on every meal. So that's like 460 meals that they looked at. Emergency department, Jill talked about the Gold Plus Mission Lifeline Award for patients that are having a heart attack. So on the quality end, we look at how fast can we transfer those patients. And the goal is to be less than 60 minutes for the national average. And we do it in about 26 minutes. So they're just flying down there to get patients out because it saves the heart muscle. And so they do an excellent job here. Environmental services looked at assuring sharps containers are removed properly. Kara is very busy in infection prevention with COVID. And then she's also looking at hand hygiene compliance, which was like up in the 90-some% compliance. And then Drew Becker looked at assuring timeliness of completion of work orders. And then he has a very large environmental safety report that he does once a quarter. So busy times.
Always busy, always improving. So
Yes.
that sounds good. Anyone have any questions for Ann? All right, thank you, Ann. And we'll move on to the approval of the joint conference committee policy and procedure revisions. Karen.
All right, joint conference met on November 2nd. I'll go ahead and pass around. These are all of the policies and procedures. I'll go just high level, since I know you guys have a lot to go over today. But first off, we look at, for the full year, we have certain departments report every quarter. So for the full year, and I bring you the quarterly ones, so I'm not going to go into detail on these because we'll talk about the quarterly ones. But for the full year, we had credentialing, discharge planning, education, fiscal services, payroll, infection prevention, marketing, OB, birthing center, pharmacy, quality improvement, rural health clinic, and safety manuals. So we went through all of those policies. Then we also go through any new or changes to policies in the previous quarter. So I'll go into a little more detail on those. So for the quarter, dietary, they formulated a new policy for cleaning up in the dietary department to follow code. They revised their dietary manual, so every year they look at their dietary manual and they adopt any new changes. So they had the 13th edition of the Simplified Diet Manual for 2021. So they did adopt that. It did go through the medical staff, and so that has been approved for our facility. Human resources, there were some changes with OSHA, a lot of COVID changes. So OSHA changes with COVID, so they implemented those. Let's see, it's the immunization vaccination program. So again, we talked about flu vaccinations coming through, so they had some revisions to that. Then medical records had formulated a new policy for public health department access to Myrtue Medical Center electronic health records. So basically allowing public health to access our EPIC system so that we can have better coordination of medical care by having them able to see our records as well. So that was a great new policy for them.
Has that already started?
Yes. Yep, that's
okay.
In place. Let's see, occupational health, scheduling and ordering respiratory fit testing. So we do fit testing for COVID. We have the masks, the N95 masks that we have to wear in healthcare. So those have to be specially tested or fit to our faces, and then, so everybody has a different face. There's different sizes, and the idea about that is that COVID then cannot get through those masks. So we do that here at the hospital, obviously, for all of our patients, but they also have that now through OHO services in other facilities as well, so they can do that. The surgery departments had a revision to their callbacks, just basically updating the hours and the expectations of when they have to be called. So if they're on call and they are called back in for an emergency surgery, et cetera, the time frames around that. So those are the new policies from the quarter that they reviewed. So unless anybody has any questions, I do need approval from the board. These all have gone through the medical staff, and then Rick and Kelly are on our committee as well.
Almost a lot to review, so
Yeah.
Appreciate everyone's efforts. I would entertain a motion for approval on that revision as Karen just presented it. Jen's moved, is there a second?
I'll second it.
Tom seconds, all those in favor, please say aye.
Aye.
Aye. Opposed, same sign. Motion carries.
Thank you.
All right, a significant portion of our meeting is Tom Cannon this morning. So Tom, we'll turn it over to you.
Well, we'll try to summarize a little bit, quite a bit of activity since we're kind of including a couple months here. As far as initial appointments, we did have a total of 10 initial appointments. As far as reappointments, we ended up having a total of 7. And then we did have 4 voluntary withdrawals, 2 in consulting psychiatry, 1 in consulting emergency medicine, and the other in consulting urogynecology. So a fair amount of activity along those lines, but everything appeared to be in order.
Very good. Entertain a motion on the credentialing slate as Tom has shared it.
I'll make that motion.
Rick, I'm going to go with Leona moved and you seconded, okay?
Sounds great.
All right, all those in favor, please say aye.
Aye.
Aye. Opposed, same sign. Motion carries. Thank you, Tom. Next is Barry, CEO report. So we'll turn our attention to you, Barry.
I'm going to start with our January 1 pay increases. over the past month, we've been evaluating pay scales and pay rate increases that will go into effect January 1. This is the first year of combining a market raise with a merit raise. In the past, we had 2 raises each year, a market increase on July 1 and a merit increase on the team member's anniversary date. Our department managers are wrapping up the annual employee performance review process that will determine the merit portion of that January 1 pay increase. This year, our market evaluation has shown more significant increases in certain positions. As everyone knows, we are in a very difficult market because of the labor shortage, and I think Jill's presentation kind of illustrated that as well. This is not just impacting us with RNs, although that is one of the most difficult areas and is in the highest demand, but we're also impacted in many other areas due to this shortage, in addition to nursing. So our January 1 pay increase will average 4.9%. And that incorporates both the current market and the team member performance appraisal. In addition, there are positions where we've done a one-time adjustment, moving the pay scale upward to align better with the market. The January 1 pay increase and current overall wage valuations align with our forecasted salary budget approved by the board back in June, and will place Myrtue in a better position for staff recruitment, retention, and operational sustainability. And this has been discussed in detail with our board finance committee. So the next area that I want to talk about is kind of review some of our telemedicine efforts. I wanted to talk about telestroke first. That program has been in place for a couple years with UNMC, so it gives us access through telemedicine to neurologists. So for those stroke patients that are presenting in the ER, that's been a really good program for us, and it is getting utilized quite a bit. So we did, that contract came up for renewal November, I think it was November 30th. We did renew that for another 2-year period. So we'll continue with that telestroke program with UNMC. Another telemedicine area that we're looking at right now is an acute care pulmonary support program. And so in the past, we have used this program through Bryan Telemedicine. During 2020, we had it for about, I want to say 3 to 4 months. We did end up terminating at that time because it was maybe not utilized quite as much as we wanted to, and it was a very expensive program the way it was set up at that time. But they've tailored a new program that's catered more to critical access hospitals, making it more affordable and still providing us with the expertise that we would like to have. Our census has been very high here recently. We're having a very difficult time transferring patients. So we are taking care of more complicated patients, and we think having this access will help us with that moving forward. So we're in the process of finalizing that contract with Bryan Telemedicine. Neurology, I've talked a little bit about neurology in the past, and we are working with the Carroll Hospital and Atlantic Hospital to recruit a neurologist. We have someone in the pipeline, and we think we'll be pretty good chance we'll be moving forward with that individual. Probably would be starting March, April timeframe. We do have a luncheon set up with our medical staff to meet with this individual. So hopefully that will move forward a little sooner than what we kind of thought. We thought that would be a pretty difficult recruit, but it's happening a little faster than what we thought. Dr. Shu is a partner with Miller Ortho, and she's a hand surgeon, and she's going to be joining Myrtue. She'll be coming out a couple days per month, half days per month, so that would be a great addition. So those are kind of the physician, I guess, updates. Facilities-wise, we did complete the RHC window project. That has been, it's not quite complete, all the windows are installed, but there's now some finish work that needs to be done inside with drywall and some of the window sills. So there's still a little bit of work to do, but the windows are installed. The roof project is scheduled for this month. I think we got that approved. It's been several months ago that was approved. The pool is done and it reopened this morning at 6 a.m. And we do have someone here that's actually used the pool since it's open, so do you want to make a few comments, Ann?
Terry, you knew I was in
I was gonna say, you seem to be smiling more when I called you this morning, and I'm so happy it's back for you.
So from the 6 a.m. senior water aerobics ladies, we love it. And Dick O'Brien was there as well. It is awesome. The floor seems softer. I don't know what they all did, but there's also a little bit of a bubble or something on there to kind of hold you in place when you're working out. It's beautiful. We love it.
The pictures I've seen look very nice.
Yes.
So that's exciting.
It's very nice.
Thanks for the first person account of being in it. So, should we all go after the board meeting? We didn't plan, did we? No, we don't have our suits. Thank you, Barry. Go ahead.
So just, I think the last thing related to facilities is the central utility plant project, and I'm going to let Jeff do a little bit of a...
Yeah, and have you seen over the last week, there's been a lot more activity outside. There has been a supplemental dirt work and concrete company hired. They have poured all of the concrete on the drive in the back, expecting to open that Monday afternoon. So the MRI truck now can drive straight through. Yesterday they poured all the foundations for the pads in the chiller yard, or where the condensers are going to sit. Today they're going to pour the actual pads for the condensers and then start constructing forms for the walls and the foundation for the walls. Monday, like I said, the condensers will be moved to their final location, as well as the propane tank. We'll open up the drive for the MRI truck, so it's safer there. There's been a lot of work going on inside that we don't see, but we have taken the chiller offline, so today might be a little warm with the warm weather outside. However, also on Monday or Tuesday, that chiller will be dismantled, so you won't see it anymore outside. There is a water cooler inside the plant that is being dismantled right now that will free up space to put the water boilers in to move forward with that. So a lot of piping that goes above the floor and behind maintenance areas that we just don't see people working. So things are progressing quickly. Once we get the condensers out, it'll be progressing a lot faster moving forward also.
I would like to see the boiler room at like a after now, since I've seen the before. So
Sure.
That would be welcome sometime when we get that chance.
Yes, anytime you would like, we can take you.
Thanks, Jeff.
I don't have anything else unless there's any questions.
Any questions for Barry from anybody? All right, thank you, Barry. Let's continue on with the approval of capital purchases, and we're talking with Carrie about a piece of portable x-ray equipment. Carrie?
Morning.
You're over here most of the time. Now you're over there. Good morning.
Okay. Okay, I'm here to talk to you this morning about replacing our portable x-ray equipment. So we currently are using a piece of equipment that we purchased in 2011. We're having some problems with the computer on that unit. It's not working up to standards. It's causing us some delays in processing work lists so we can pull patient names up and sending our images. And we've been working with our vendor. We've been hoping to get it upgraded to Windows 10, and that would solve our issue with it. But unfortunately, the model of portable that we have and the age of it, it's not able to be upgraded. So that's the background of why I'm here. So we've been looking at some different portable units, and in looking at newer units, we're finding that there's improved image quality. We have some additional enhancements that we could benefit from on the newer units, and they come with the Windows 10 software. So that's really where we want to be at with our software right now. The transfer speed would be faster, so that allows our providers to be able to look at the images quicker when we are doing portable imaging. And it's interchangeable with our other X-ray room detectors. So there's a panel that we use to actually obtain the image, and that captures it and sends it to the computer. And we can use the panels in between all of our X-ray rooms and our portable. And we also have been talking about keeping our current portable. We want to make sure that we always have a consistent portable option for our providers and our patients. And if we kept our current portable, we'd have that. If one portable was down, we'd always have another one to be able to go and do that imaging. Unfortunately, when a patient is, in a critical condition, or we're maybe going up to do a newborn up in the nursery, those patients aren't always able to be transported out of the ER or out of the nursery. So we like to make sure that we always have a portable option to be able to go and take care of them in the setting that they need to stay in. So keeping our current portable as a backup would allow us to be able to do that. So looking at new portables, we found with the techs that they're easier to maneuver. We have better visibility in driving them down the hallway than what we currently have right now. And then some new features on them that allow them to set up for the exam even quicker than what we can right now. When we're using a portable, it's typically a pretty critical situation, so we want to be able to move fast, get the image fast, and get out of the way so that the providers can continue to take care of that patient. And with our growth, we can continue to provide our consistent service with our portable X-ray. We found that since the onset of COVID, our portable chest X-ray exams have increased 48%. So that's a very popular exam for our COVID patients. And instead of bringing them through hallways of the hospital from the clinic or from the ER, we've taken the portable to them to keep them in the room that they're already in. So we've seen that increase tremendously since COVID started. So these are a couple images of the portable that we as a clinical team have decided that we would use, would be the best for us to use. And I kind of talked about being able to maneuver it easier. It's going to be easier to drive. And the column there that you see on the right that kind of has a little shadowing on it, that actually collapses down. So right now that column stays up on the portable we have, so when we're driving it through the hospital, it's kind of hard to see around. That column would actually collapse, so you'd have a good line of sight. The handle that you would that you see there below the image that the tech would hold on to, that can be lowered or raised up depending on the tech height of the tech. And then there's also buttons on all sides of the top part of the portable. So no matter where we're standing at the patient's bedside, we're always able to maneuver it, not having to keep walking around to the front side of the portable, which just saves us a little bit of time also. So financially, we looked at a couple of different vendors. We currently have a Shimatsu portable, which you see on the left. And this is an upgraded version that would allow us to continue to reuse that detector and be able to change them throughout the X-ray rooms. So we looked at Shimatsu, and then we also looked at a Siemens unit. You can see the comparison there. With the Shimatsu, we're looking at $143,000, just a little bit over that for the unit. And then our service at $13,000, about $14,000 annually. They do both give us a warranty of 12 months. So you can see the 5-year cost projections there at the bottom between the two. For facilities, we wouldn't have any updates. This basically just gets plugged in. So wherever there's an outlet, we can park it. It doesn't take anything different for us to build out for that. So because of that interchangeability, we would recommend purchasing the Shimatsu unit so we can continue to use that with our other detectors. It's the Shimatsu Mobile DIRT MX8. Any questions?
Are there any service fees on the present one that will continue on?
Yeah, that's a good question. We did talk about that. So we would still do a PM, so preventive maintenance we would want to do every year on that, so we would pay for that. But we would cancel our current service contract with that vendor, which is our same vendor as this Shimatsu unit. And they would just cancel that contract free and clear for us. They wouldn't do any penalty for cancellation, or we wouldn't have to continue to pay the remainder of that service contract. So just a PM only per year. And I don't have that exact figure, but it'll be fairly low compared to a service contract of this nature.
Okay, thank you.
Not only is our present one 10 years old, it's worked harder in its last 2 years of
It has.
life here, so.
It has been used, yes.
So,
And you
I'll
know,
make a
because of the tide of COVID, we can use some of our federal funding that we have received to cover the cost of this piece of equipment, because it's assisting with our COVID patients and restricting the exposure to other patients and staff.
timely. Good. Jim, you
I'll
were
make a motion to approve this new purchase.
second for that approval.
I'll second.
Janine seconds. All those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Thank you very much.
Thank
Sherry.
you very much, appreciate it.
I hope it serves us as well as the old one has.
It should,
The need will be there.
yes.
All right.
Thank you.
As Paul Harvey said, page 2. Data storage array.
Yes, sir. Our storage array is where we store all of our electronic documents. It is currently at the end of life in the service, coming up in the end of February. So it's still usable, but it's slow, it's full. We're at capacity currently, so we frequently, about weekly or twice a week, are going out finding data that is very old, hasn't been accessed, working with the end user to, hey, can we delete this to open up more space so the new documents can be saved. We reviewed 2 different technologies. One is called hyperconverged, and what hyperconverged is you have a server and you max it out with all the storage and disk drives that you can. You have a second server, max it out as much as you can. It uses something called compute and storage together, and then all the servers talk together, so it knows where data is stored across all of the different servers. Our current server configuration does not accommodate hyperconverged. It's about 50% of the industry is migrating there, but we would have to buy all new servers, all new hard drives. One of the drawbacks with it, for us anyway, was we're data heavy, we're data light, compute heavy. We have a lot of compute power. But with hyperconverged, when we need to add more storage space, we would have to buy a whole new server along with that storage space. So the ongoing costs just increase quite a bit. A traditional storage array is, about this big, about this wide. Sorry, Rick, you can't see, but it's a light computer, a light server with lots of bays for hard drives. The model we're looking at has 42 terabytes worth of space that we're looking at. We currently, on our existing system, have 32, I believe. So this would give us some expandability. But it is just a higher, newer version of what we have. Has more features, but really feel that it's a better option. And what a new storage array is, better performance. They're faster, they're more efficient. They have deduplication, so if I send out a document or a link to a document that people want to save, and they save it on their drive. Now, on our existing, we have 2 copies. But on the new one, what will happen is if I send it out and somebody wants to save it, a pointer is actually saved to where the one document is, but both of us have it in our drives. So it deduplicates data and saves space. Lots of security features around the new systems, which today, I mean, it's security issues are rampant and issues are coming forth. So this would help us secure data. They're much faster. We would use what's called a hybrid solution. So part of the drives would be solid state and the other part would be spinning. So the spinning are much slower than solid state. So that data that we use a lot would go on solid state, and that data just for long-term storage goes on the spinning drive. So it becomes a lot faster. Everything we have today is on spinning drives. It is expandable, so when we come up to a point where we need more space, we can expand this unit up to close to a petabyte in space pretty easy. And then management is a lot easier. The estimated cost that we got on the hyperconverged for approximately 42 terabyte worth of space comes up with just the hardware about $156,000. We would need new network connections and some contingencies coming up to about 170, give or take. Traditional storage array obviously is a lot more cost effective for us. It's about $55,000 for the hardware and drives, and then the network connection contingency for a total of about $68,000. With that, we would like to get your approval to move forward and purchase a traditional storage array to upgrade our storage, increase capacity, hopefully make things a lot more efficient and faster for all of our ambulers. With that, I'd entertain any questions you may have.
Questions? This was a capital expenditure that was planned for.
Yeah.
Remember correctly?
We had approximately $100,000 requested at the beginning of the budget, so.
Okay. So our motion, I mean, we're approving that amount right there, 67.
Yes.
952.
Yes, sir.
I'll make a motion.
Okay, Leona has moved, is there a
I'll
second?
second it.
Tom seconds, any discussion? All those in favor, please say aye. 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 Opposed, same sign. Motion carries. All right, Jeff, thank you for that opportunity. Elevator repairs, next.
All right, we have, five elevators in the whole hospital. Two of them that we're looking at that are needing some additional work are the west elevator, which is down by our inpatient that goes from the first floor to the second floor, and the other is the elevator right over here. The west elevator was actually installed in 1964. That equipment is still there and running. The east elevator over here was upgraded in 1979. I believe it's part of the 1952 building. So they have some age. They served us very well. We are starting to see a lot of repairs that are increasing. One of the issues we have because of the age is parts are hard to find, and when we do have an issue, the outages are exponential in length. One of the last ones on the west, that elevator was down about 5 weeks before we found the part and was able to bring it in. They're a little slow. There's a few compliance issues from when they were installed 40 years ago. Compliance has changed since then. So a little bit about the history that we've got here so far. So the maintenance repairs, we do have one of the pumps has a leak, and there's a few other parts that need to be upgraded. But as kind of trying to be more proactive and keep everything in a great operating position, we evaluate what do we need to have done. So we had TK elevators, which was O'Keefe. They're the ones that have our current maintenance on the elevators, go through and give us a proposal on what all needs to happen. What needs to be maintained would be the control system. So new and improved control system that we would implement power units. That's everything that controls the pumps, the doors, the lights, everything would be repaired. One of the things that does fail frequently is the operating of the doors opening and closing. It's particularly interesting when we have a issue at the clinic. We have to bring them to this elevator up and then walk them all back. So even though that won't be updated or repaired, maintained this fiscal year, we'll be looking at it possibly next year. The hoistway equipment, which is the lifting mechanism. There's also some EDA changes that have happened that we would maintain and get them up to current code. The hall stations, the buttons that we push and the controls that are there, position indicators above would be updated, and some of the cab interior would be updated and handrails raised and lowered as appropriate. The proposals came back for the west elevator down here. Our oldest to fully maintain that is approximately $112,000. The car would be an additional $15,000 on top of that. For the east elevator, just short of $160,000, and the car would be about $14,000. A couple other things as well, we have them down. We can update the flooring. We would do that ourselves, but we would just purchase the flooring. And then a bit of a contingency, so if we do run into an unforeseen item that was, once we get tearing into the systems, how that would go. This does come annual maintenance. We do have a maintenance contract for all 5 elevators plus 3 dumbwaiters, so this would be included into that ongoing. The timing would be each elevator is approximately 5 weeks worth of work to take it down, remove all the pieces that need to be updated, maintain them, rebuild, and put back in. With that, I would like your approval to maintain, repair the elevators to get them up to current. This should take us out another 20 or 30 years for work.
On these 2, or what about the other 3?
The other 3, the one that's straight over here, that is a patient elevator, that is only 9 or 10 years old, so that one is in great working shape. The one elevator is the freight elevator, which we will be looking potentially next year to see what we may need to do there, but it has been in, knock on wood, very good working operations. The rural health clinic one, we would look at upgrading next year, or maintaining, repairing everything. We do have a few occasional issues with that, so that is not as old as what these 2 are.
But we're talking the same kind of money coming up next year for...
Possibly. We don't know what all it's going to need to maintain and fix. So hopefully, because it's a little newer, it's a little less.
I would not guess we had 5 elevators. I wouldn't
No,
have thought about how many there were, but yeah. And I didn't know we had dumbwaiters until you just said that.
Yeah, we've got, I believe, 3. Rural Health Clinic has a couple, and there's one down over on this end of the building.
Okay, I'd entertain a motion on the approval for elevator repair and maintenance as presented.
Oh, I'd make that motion.
I can make that motion.
Oh.
I'll second it, Jerry.
All right, we'll go with Janine moved, Rick seconded, please.
Gotta have elevators.
Discussion? All right, all those in favor, please say aye. Aye.
Aye.
Opposed, same sign? All right, we'll look forward to upgrading and improving the elevators.
Thank you very much.
Thank you, Jeff.
What's a new elevator cost?
We kind of looked at that. They were between $200,000 and $250,000 to kind of get. We'd have to strip the whole tower out, put all new rails, all new car, everything. It was quite a bit more. This keeps the existing car and the travel way. Those are okay, but a brand new elevator is quite a bit more. Over 250 plus.
Makes sense.
Let's not ever do all 5 of them at once.
Right.
Okay, Christy, more financial pieces here for us this morning.
Okay, so the condensed financial report for October, we're just trying to finish up November, so we'll bring that next time. But our outpatient visits continue to increase. We are pretty much back for the first 4 months of this fiscal year, back to what we were the first 4 months of last fiscal year, over 22,000 outpatient behavioral health visits. Emergency room visits have gone up significantly, 25% for the first 4 months of this year compared to last year. I would venture to say that's because of COVID, people coming in to get tested. Surgical procedures are maintaining pretty consistent, 460 for the year, roughly 9 less than last year, but pretty consistent. The clinic visits are up 15%, so we are at 16,800 for this fiscal year already compared to the 14,600 we had last year at this end of 4 months. Our average daily census is up, which is continuing to rise. We're at 9.81 patients per day compared to last year for the 4 months at 8.14. That is a 20% increase. And it is in our acute patients, so we are taking care of more acute patients in the hospital. As Michelle mentioned, our births are doing wonderfully this year. We're at 28 for the 4 months ended at the end of October, and 16 for the previous year for those 4 months. So we're continuing to see that in the month of November also. So operating revenues, net operating revenues were 16 million. A little under that for operating expenses for year to date. So we do have a net operating gain. We have net operating, non-operating revenue of $416,000. So year-to-date, we're at net income from all sources of $670,000. Last year, we were at $380,000 for the fiscal year for the 4 months ending at the end of October. So we are seeing a 68% increase in our net operating income from all sources. Just to talk a little bit about our financial statements, we are still pretty strong. Our cash balances are continuing to be high and increasing. We do have as Jill mentioned, we are struggling getting coding. So we are seeing an increase in our accounts receivable because we have caught up so far now. So all those bills are out to the insurance companies waiting to pay. So we'll see that higher accounts receivable through November. And hopefully by the end of December, we'll see that coming down a little bit again because those claims will be getting paid. Inventories are increasing a little bit. That is mainly because of pricing increases. Most everything else are assets. So we're pretty strong in our assets yet. Our liabilities remain pretty consistent. Our accrued liabilities for payroll are up at the end of October because of timing of accruing our payroll for the month, and it is a longer month. And because of our increase in services, staff are having to be a little more conservative about taking PTO because we need them here. Advances from third parties is that advanced Medicare payments that we got, and as you can see, we have paid back a little bit over $400,000 of those. They're just withholding them from our payments. And you do have a more detailed income statement in your board packet. Is there any questions on the financial reports?
What's the payable to third-party payers?
That is what we reserve back based on what our contractuals are and reserve back for future audits because they'll come in, they have to audit us every year. It's been a couple years since they've audited us, but they'll audit our cost report and financial report and then potentially can come back and say, we owe you this money or you owe us money. So we conservatively reserve a little bit of our revenues to make sure that we're covering any potential liability that we may have to pay back because they look at it in more detail. And last year it was a negative because with COVID, our expenses went up so significantly that they owed us money. Pretty significantly.
That was my concern, was what the big swing was between the two years.
Yeah. So when we filed our cost report this year, last year they owed us over $1 million. The Medicare system owed us over $1 million. This year they only owe us like $150,000. So there is usually something that they owe us, but it's getting tighter and tighter, and then we want to be able to have some reserves for if they come in and audit and we owe them some money.
Sure.
Okay, I would entertain a motion to approve the financial report.
I'll make a motion.
Thanks, Jim. Is there a second?
Second.
Janine, thank you. All those in favor, please say aye. Aye. Opposed, same sign. Motion carries. All right, now payroll and claims for both October and November of 21. Questions?
Nothing out of the ordinary, really.
Christy, who is Graphite Construction? What do they do for us?
Graphite is the cup project.
There's a what?
It's the cup project.
They're the general contractor.
Okay, I noticed we paid out significant amounts of money for that.
Yeah.
Thank you.
I was going to ask earlier, is the cup project on target then?
They're still estimating to be done in the mid-end of April right now, and contractually they need to be done by the end of August.
I got to think that this weather has been
phenomenal for them.
I don't know how they would have done it if they couldn't have.
Right. Yep.
Yeah.
We're very lucky that way.
We are very fortunate. It's nice to see activity there.
Good progress. So I'd entertain a motion to approve both the October and November payroll and claims.
I'll make that motion.
Thank you, Leona.
Second.
Jim has seconded Leona to move for us. All those in favor, please say aye.
You need some coffee?
Taylor, yes.
That motion, I vote aye. That motion carried. Anything else for us to consider as we wrap up today?
It's early.
Merry Christmas to everyone, and thank you to everyone who helps this community and this facility carry out its mission. So we'll call it good. Thanks. Move to adjourn. Someone.
Thanks, Gary.
So moved.
Jim moved, Leona second. All those in favor, please say aye.
Aye.
Motion carries. We are adjourned at 8:43-ish. You okay with that, Ruth?
You betcha.
All right, thanks. Everybody have a good day.
You guys.